this motion, Madam Speaker, because already we have the mental health policy, the Kenya Mental Health Policy 2015 to 2030. And when you look at that policy, there are policy measures and interventions that are proposed. And therefore, what I would beg is if we could expand so that we expand the scope of the implementation of that policy. However, Madam Speaker, I am also a member of the Health Committee. And it is clear in my mind that the issues of mental health have not received the requisite attention as they should in this country. For us to be able to go to, when we look at the level of the organization of healthcare in this country, the level, from level 1, who are community health promoters, to level 4, there is nothing for mental health conditions. And therefore, you find that even the referral system and the organization of healthcare is not responsive enough to healthcare needs. In a country where available data, and this data is actually almost 15 years old because it is 2015 data, 1 in 4 persons who seek services in our outpatient health facilities have mental health issues. Secondly, in Africa, Kenya is the country that has the 4th highest cases of mental health conditions. But when we look at what the interventions that we need to make, first, at the community level, we should be able to deploy medical social health workers. But today in this country, we have a large pool of of social workers who are jobless. And therefore, the request for collaboration between the national government and county government so that we can deploy the medical social workers in communities is a welcome move. And even possibly an integration of the medical social workers within the community health promoters setup that is already in place. In our schools, where quite a number of us who have spoken before me have indicated that these conditions are easily seen, we need to be able to post clinical psychologists. And therefore, if we are to be able to do that, then we need either to get the Ministry of Education and the Teachers Service Commission to actually begin employing clinical psychologists as teachers in our primary or junior secondary, primary schools, junior secondary, and basic education institutions. Madam Speaker, when we get to the level where mental health services are available, they are mostly available in very few level 4 hospitals, mostly in the level 5, which are county referral hospitals, and the Mathare National Psychiatric Hospital. The Mathare National Psychiatric Hospital is the hospital of shame in our country. It is old, it is dilapidated, and it is stigmatized. And therefore, as a house, even as we pass these motions, then the voting of the liquid site resources to go with the motions that we pass must also gain priority and remain within our sites when the budgeting cycle begins. Madam Speaker, when we come to the family setup, despite depression, and by the time families decide, or even individuals decide, to go and seek help for depression, it is almost always rather too late. It is advanced. And therefore, the early warning signs, we need to have people within the community who are able to pick these early warning signs. But depression is not only disorder, the only medical disorder, as it has been ably communicated by the speakers before me. Madam Speaker, we also need to revisit the Mental Health Act, which was first established in 1978 and since then was only amended once 10 years later in 2018. We need as a House to revisit that act in order to align it to the current realities on mental health. Madam Speaker, I believe there is a connection between the escalating cases of GBV and mental health. And when we look at then the cost to the economy of both mental health, GBV, issues of suicide, which have now been reported in primary school kids, and a perusal of the suicide records within our police stations would give us a clear map and inform the gravity of this situation. So, Madam Speaker, lastly, is the training of the personnel that are needed to treat those who are already diagnosed with mental health issues. Madam Speaker, more than half the counties, or approximately 50% of our counties today do not have psychiatrists. And the country has a severe shortage of psychiatrists. Again, psychiatric nurses, we again have another huge shortfall. And therefore, there is a need for us also as a House to again vote in money specifically to, and ring fence the money specifically to go towards the training of mental health medical personnel. Madam Speaker, I beg to support.
Thank you. The Honorable Susan Kiamba, member for Makueni.
Thank you, Honorable Speaker. I also wish to put my voice to this very important motion that was brought by Honorable Mishimbogo, and I think it has actually come timely. Honorable Speaker, we realize that the issue of mental health attacks the head, the brain, and the brain is the engine of the body, which means if we don't address issues that affect the engine of the body, then of course it is going to resort into very many problems, social, economic, and even spiritual. So we realize this particular policy that Honorable Mbogo is proposing is very important, because if we have a policy that spells out all mainstreams issues of mental health from national to county level, I think such a policy will, one, help us to identify mental health as an issue. Because when you look at Kenya today in most communities, issues of mental health, they are perceived as curses. Even most people, when they meet somebody who is suffering from mental health,